Okay, all right. So we're gonna do some practice questions. And this time, the questions that I have for you guys today are really hard. Okay, like because it's my goal to really challenge you right now with the questions that you're exposed to, and really help you to process the questions. So, the questions that we're gonna do today? Actually, we're gonna move over to physiological adaptation questions. Okay, physiological adaptation questions. So hopefully this is going to really help you to better understand how to correctly look at the questions. And here's the thing I say that you should already know and understand. If you don't if you don't see the content correctly, you're going to see the questions incorrectly. Okay, if the way you understand the content is wrong, then the way you see the questions will be wrong. So that's why I stress you have to first understand the content, and then next it's like in steps. Then next you need to understand how the exam is going to connect the content and convey it into a question. And that's the part where you need the critical thinking skills. And that's what I'm imparting to you by showing you the correct way to eliminate the choices. Okay, so let's go ahead and do a question. So these are going to be some hard ones. Well, you know what? I think I want to do. Okay, we're going to do this one, and then I'm going to do like different type of questions. So here's the first one. It says, in which patient would the nurse expect to see a green stick fracture? Okay, in which patient would the nurse expect to see a green stick fracture? And this is spelled GREENSITCK, fracture. Okay, so the choices are a 72-year-old female who fell while in the shower, B, a 50-year-old male who fell off a ladder while fixing his roof, C, a 28-year-old male who fell off his bike while in a triathlon, or D, an 8-year-old male who fell off a trampoline. So let me say it one more time. In which patient would the nurse expect to see a green stick fracture? Is it A, a 72-year-old female who fell while in the shower, B, a 50-year-old male who fell off a ladder while fixing his roof, C, a 28-year-old male who fell off his bike while in a triathlon, or D, an 8-year-old male who fell off a trampoline? So go and think about what you believe the answer might be. Let me see if I can write on this then. Think about what you think the answer might be. Let me see. Oh, okay, let me see. Okay, there we go. Wow, that's so cool. Okay. Okay, I just wanted to put that so you can see how it's spelled. Oh, look, that's really interesting. So that's what. So it's a green stick fracture. That's what the word is. Okay, so let's go to eliminate this one. Let's figure out what the answer is to this one. Okay, so I'm just gonna erase it now. Okay, so let's go talk about what the answer is. So here's the thing about this question. Let's say, for example, if let's say I didn't know what green stick fracture is. Okay, let's say I didn't know. Let's say I had no idea what a green stick fracture was. So this is the part where you can use some very, very, very strong clues to help you figure out the answer. And fortunately this is not a select all apply question, so I would look at the choices and I would begin to see what is similar and what is different. And I would use that to help me pick the right answer. You see what I'm saying? So if I had no idea what a green stick fracture is, and I'm just showing you, even for anything, you want to look for what is similar and what's different, and then that will help you to decide which one should go with which. So the first one, the first choice says a 72-year-old female who fell in the shower. The second one says a 50-year-old male who fell off the ladder. And the next one says a 28-year-old male who fell off his bike while in a triathlon. And the last one is an 8-year-old male who fell off the trampoline. So what I would be thinking in my mind is, you know what? Everybody is an adult except for the last person, right? Everybody, all the choices, 28, 50, 72, they're all adults. That's what I'll be thinking. But the last one is the only one that's a pediatric, is a child. And and then I'll start thinking, because now I'm putting on my nurse's hat, and I'll start thinking, well, maybe this type of fracture is something that's more sensitive or prone to younger people because their bones aren't as developed yet. That's the type of conclusion I would draw to, because I'm looking at what's consistent and what's not. And so I would say, okay, everybody else is adult, but this is the only one that's not, right? And it can only be one choice. So I would choose the 8-year-old, because none of the things that happen to them, like the other choices as far as falling out the shower or the roof or the triathlon, they don't have any commonalities. And nothing is really, the event is not the significant part of the statements. So the correct answer is D, an 8-year-old who fell off the trampoline. And here's the thing about this question. Let me tell you the reason why the Nclex will tell you why the answer is D. A green stick fracture is something that occurs at the epiphyseal plate in bones that have not yet stopped growing. I'll say it one more time. A green stick fractures, they occur at the epiphyseal plate in bones that have not yet stopped growing. So that's the answer. And so in this situation, because this child the bones haven't stopped growing, that's the reason why they're more prone to the fracture. So that thought process I would be thinking, that helped me to choose that answer. Does that make sense? Hopefully you saw, that's a very easy way to eliminate the choices if you don't really know, right? Let's say if you have no idea what green stick fracture is, that's how you eliminate the choices. Okay, so let's do another one. Oh, I think I might sneeze. Okay, let's do another one. Okay, so here's what the question says. The nurse is admitting a client with hypoglycemia. Identify the signs and symptoms the nurse should expect. Select all that apply. Okay, I'll say that one more time. The nurse is admitting a client with hypoglycemia. Identify the signs and symptoms the nurse should expect. Select all that apply. Is it A, thirst, B, palpitations, C, diaphoresis, D, slurred speech, E, hyperventilation? I'll say it one more time. The nurse is admitting a client with hypoglycemia. Identify the signs and symptoms the nurse should expect. Select all that apply. A, thirst, B, palpitations, C, diaphoresis, D, slurred speech, E, hyperventilation. So whenever you're ready, go ahead and think about what you believe the answer might be. Okay, so with this question, you just have to know what hypoglycemia is, all right, in order to get this correct. So there are commonalities that hypoglycemia has, and the other choices are, this is one of the choices where you have to just understand, once again, what hypoglycemic symptoms look like. And this is when the blood sugar is low, right? The blood sugar is low when somebody has diabetes. And here's the thing I could say too, and this is another topic, but we all can be hypoglycemic. We all can have a low blood sugar. Now we all can't be hyperglycemic because that means you have diabetes. But you can have a low blood sugar. You know, you can have it where you didn't eat anything, right? So we can all be hypoglycemic. But anyway, so the first one, it says thirst. So thirst is actually a symptom for hyperglycemia. Okay, thirst is actually for hyper, not hypoglycemia. Then the next one, palpitations. Yeah, that's a symptom of hypo. The heart starts beating more quickly. Okay. Then the third one is diaphoresis. That's a huge one. These are all the symptoms that they have. They become diaphoretic. And here's the thing: if it becomes really bad, like where we really ignore the symptoms, then they'll have slurred speech, and and now they're so lethargic. Because, okay, let me tell you one thing too. Like when the patient is confused, their speech will change and it'll be more slow. So they're gonna have slurred speech. Absolutely. If they're hypoglycemic and they're severely hypoglycemic. Some people can be hypoglycemic and they don't have the slurred speech. They're talking to you, but the sugar is low. It's all kind of in stages or in levels. So, and then the last one, hyperventilation, that's actually not a symptom with hypoglycemia. And I don't think that's even with hyper either, actually. So, yeah, that's not even with hyper. So anyways, though, yeah, so those are the choices. It was B, C, and D. So hopefully you got that one correct. Okay, so let's do another one. So here's a question. It says the results of an adult's blood pressure screening on 3 occasions are 120/80 millimeters of mercury, 130/76 millimeters of mercury, and 118/86 millimeters of mercury. How will the healthcare provider interpret this information? So let me say the question one more time. The results of an adult patient's blood pressure screening on 3 occasions are 120/80, 130/76, and 118/86. How will the healthcare provider interpret this information? Is it A, normal blood pressure, B, hypertension stage 2, C, hypertension stage 1, D, pre-hypertension? One more time. Is it A, normal blood pressure, B, hypertension stage 2, C, hypertension stage 1, or D, pre-hypertension? So just think about what you believe the answer might be. Okay. All right, so let's do this one. I'm just looking at some more questions. Okay. All right. Okay. So anyway, so for this question, it says that the blood pressure is 120/80, 130/76, and 118/86. So here's the part. This is the part I talked about before about vital signs. You have to understand how to interpret vital signs. So what do we know? We know the normal blood pressure is 120/80. That's right, right? And so anything, if the systolic is 120 and below, that's normal. And then if the also, like, you know, the 80 around that range is that around that the diastolic, that's also normal. In this situation, 2 out of 3 of the blood pressure is normal, but one of them, 130/76, is abnormal. So this is the part where you have to be aware of the ranges of blood pressure. Okay, you need to be aware of the ranges. So in this situation, the systolic is elevated. Whenever somebody's blood pressure is between 120 and 139, that's pre-hypertension. 120 to 139 is pre-hypertension. 140 and up, though, is hypertension. And then it goes even larger than that. Then it's like the advanced hyperstages of hypertension. But for the sake of this question, if the systolic is between 120 to 139, that's pre-hypertension. So that's what this answer is. That the answer is pre-hypertension. Okay. Okay, so let's do another question. Hopefully you're really following along with this, and that you're really seeing and hearing how I'm explaining the question. Okay, so let me see. Let me pull up this one. Okay, so here's what the question says. So this might be a little bit tricky, but once again, I'm trying to help you to think differently. So the question says, the nurse recognizes that a client is experiencing insomnia when the client reports, and this is a select all apply question. A, extended time to fall asleep. B, falling asleep at inappropriate times. C, difficulty staying asleep. And D, feeling tired after a night's sleep. Let me say it one more time. The nurse recognizes that a client is experiencing insomnia when the client reports, and then it's select all apply. A, extended time to fall asleep. B, falling asleep at inappropriate times. C, difficulty staying asleep. And D, feeling tired after a night's sleep. Remember, select all apply. So think about what you think the answer might be. And let me say the choices just one more time, just in case. Is it A? So it's asking you, how do you know they have insomnia? Which one shows that they're having insomnia? The A, extended time to fall asleep. B, falling asleep at inappropriate times. C, difficulty staying asleep. D, feeling tired after a night's sleep. Okay, so let's do this question. So this might be a little bit challenging if you don't understand what it's asking, okay? If you don't understand what it's asking, then you may see this as hard. So this is the part where you have to be able, and remember, it's set to apply, so it can be more than one choice. You have to be able to clearly identify what is insomnia, like what are the manifestations that someone experiences because they have insomnia that's directly related to insomnia, not like it, but directly related to insomnia. So the when it comes to this choice, the first one was extended time to fall asleep. So that means it takes them a long time to fall asleep. So they have problems with falling asleep. And then the second one, which is one of them, so that's correct. B, falling asleep at inappropriate times. Here's what this choice says actually about this one. Falling asleep at inappropriate times doesn't necessarily mean that they have insomnia, because that could be, maybe they're falling asleep because they're getting up to use the restroom at night. Just because somebody has a different sleep cycle pattern as far as like the times they fall asleep doesn't mean that they have problems with insomnia. Like, for example, maybe I sleep from 11 to 6 o'clock or something, but I don't have, and versus somebody else, they sleep from midnight to 5 a.m., or midnight to 6, whatever, however it might be. But it doesn't mean that we have problems sleeping. It's just because we fall asleep at inappropriate times. There's people who sleep from 3 a.m. to, they'll go to sleep at 3 a.m. and they'll wake up. They'll go to sleep at like 9 p.m. or wake up at 3 a.m. or they'll go to sleep at 3 p.m. and wake up at 10 a.m. Just because they have different inappropriate times they fall asleep doesn't mean that they have problems with sleeping in itself. So that's actually not one of the choices. Then the next one says difficult to stay asleep. That's a sign as well that's reported with insomnia. And the last one is feeling tired after a night's sleep. So even though they're sleeping, they're having problems with, they're still feeling tired. So here's the thing about these choices. The answers is A, C, and D. A, C, and D. Everything is signifying that the patient has problems where they have non-restorative sleep. Non-restorative sleep, meaning that the sleep is not restoring them. It's not restoring their function, and they're having problems with sleeping. So in this situation, the answer is going to be A, C, and D. And pretty much like it says is that these are symptoms. So just remember this in the future. These are symptoms often reported by clients with insomnia. Clients report non-restorative sleep. Arising once at night to use the bathroom, for example, is not signified as insomnia. Some people can get up at night to sleep, can get up during the night to use the restroom, but that's not insomnia. It's because their bladder is making them to wake up. Doesn't mean that they have insomnia, though. So that's what the correct answer is. Okay, so here's another question. A patient with glaucoma asks the nurse what he can do to improve his vision. And then we're going to do a select or apply question. We'll do another select or apply question. A patient with glaucoma asks the nurse what he can do to improve his vision. The nurse knows that. So this is the part where you have to just know glaucoma. So a patient with glaucoma asks the nurse what he can do to improve his vision. The nurse knows that A, vision loss from glaucoma can be corrected with glasses. B, vision loss from glaucoma can be helped with daily medication. C, vision loss from glaucoma will heal itself over time. D, vision loss from glaucoma is irreparable. irreparable. So irreparable once present. So is it A, vision loss? So let me say the whole thing. A patient with glaucoma asks the nurse. So the patient's asking the nurse now. The patient asks the nurse what he can do to improve his vision. The nurse knows that A, vision loss from glaucoma can be corrected with glasses. B, vision loss from glaucoma can be helped with daily medication. C, vision loss from glaucoma will heal itself over time. D, vision loss from glaucoma is irreparable once present. So think about what you believe the answer choice, and we'll choose, and then I'll go over it. Okay. Okay. All right. So for this question, this is the part where you have to just be aware of what glaucoma is. And glaucoma is pretty much a eye disease or condition that patients who usually have diabetes will develop if they don't control their diabetes. So remember that as well. It's a condition that's usually linked to diabetes. And the thing about this question is the patient is asking a question about what he can do to improve his vision. Now, here's the thing about glaucoma. Glaucoma is actually a what's the word I'm looking for? Destructive type of condition, and once somebody has it, whatever damage has done is done. So there's no medication that's gonna improve it. All we can really do is prevent it from worsening. Okay, glaucoma is a condition where once it's done, and you have to. This is the part where you have to just, as the nurse, you have to tell the patient the truth about what the effects is, and this is why we try to warn them to be compliant with their medication when it comes to diabetes. So anyway, so in this situation, when glaucoma happens, it's one of those type of diseases that once it begins to do a destructive work, that's literally what we're trying to do is just prevent it from worsening. So in this situation, the correct answer is going to be D. Vision loss from glaucoma is irreparable once present. Unless they get some new eyes somehow, it's not something that can be fixed. It's only stabilized. So we're just trying to stabilize it, but it doesn't necessarily mean. And by us telling them, oh, it's going to help with we're going to give you this medication. It's going to help to improve it. Improve is the wrong word. There's nothing that improves the vision. It's already done. So that's what the answer is. Okay, so I'm going to give you another one. This is once again a challenging one, and this has to do with medications now. So here's what the question says: when caring for a client with a central venous line, so this is the part where you need to have an understanding of what central venous lines are. Okay, and maybe I might do it might be a good one actually, just to talk about central venous lines. Let me just take a pause and talk about central venous lines. Actually, this is a good time to do it. So central venous lines, as we know, central venous lines, only the RN, okay, can handle central venous lines. And there's a couple of reasons why we would start a central venous line. One is the patient's going to be on long-term antibiotics. You want to write this down and take notes on this. They're going to be on long-term antibiotics. That's one reason. Another reason why is because they're going to be on long-term chemotherapy. Okay, because here's the reason why. If we give them these medications through a peripheral line, like a regular on the arm, right, peripheral line, it will kill the tissues. It will literally, it's called vesication, tissue vesication, and it will literally begin to kill the tissues. So that's why we give them a central venous line. And the central venous line, the way that it works is usually it's in the neck, left, right, whichever side the doctor wants to do. The procedure has to be totally sterile, completely sterile. So that's what a high priority with inserting a central venous line. And usually it's the RN can't just do it. It has to be like a PICC line nurse, or it has to be the physician. Only those people can actually insert it. All right, and it has to be sterile. The room has to be sterile. The room has to be clean. The nurse has to be sterile, or the doctor. No trash in the room. You have to empty out the trash. Like literally no fresh plants, none of that stuff. And so then the way that it works is that it's going to be usually in the neck. And usually the physician or the nurse, whoever is going to do it, they put it in, like it's like a catheter, and they thread it along down the artery, and it literally lands into the superior venous cava, which as you know, if you know the way that the body, like the heart is, goes right into like the way that the flow of of blood through the heart. So literally it lands there. So when it goes, it can go like this, right? If it's a central venous line, into the neck, all the way down, and then it lands right where the superior venous cava is, and then begins to flow throughout the heart. And that's antibiotics, and the antibiotics works very quickly, because it's very, very potent, because we're literally giving it right into their heart. Or if it's a peripheral line can still go through the arm, but instead now it's going to go through the arm, up the arm, and instead they're going to thread it. It's a longer catheter, and that's why you have to know the measurement of the catheter when they put it in and where it stops at. The number is significant. So anyways, it's going to be thread up. So when they do the peripheral line, so remember there's a PIC line and there's a central line. Both of them are central lines, but as far as where they enter is different. So the PIC line goes up through the arm, okay, and it's still central line, but it's being threaded up. And while they're doing this, they have like an ultrasound where they're watching what they're doing as well. And then instead, it is going up to the inferior venous cava of the heart. So if you don't understand what I'm saying right now as far as the anatomy of the heart, you need to go online and you need to look at the heart, and you need to see. Like, I remember for me, when I was learning the heart, I spent time like looking at the heart and studying the heart. I was fascinated with the heart. I was very fascinated with how it flows. I was very fascinated with the chambers and the atrium and the ventricles and how everything just moves, and like I just thought it was amazing. So I would encourage you, if you have no idea, talk about what the inferior venous cava or the superior, you need to see that for yourself so you can understand the whole picture of what I'm explaining. So anyway, so that's what central venous lines do. They literally take you right into the heart. And that's why it's very, very careful. We have to be careful because it can get infected. And we have to make sure we clean the site every 7 days. And it can get infected. And if it gets infected, then we have to take the whole thing out. So that's just a quick spill on central venous lines. All right. So the question says, when caring for a client with a central venous line, which of the following nursing actions should be implemented in the plan of care for chemotherapy administration? Select all that apply. Is it A, verify patency of the line by the presence of a blood return at regular intervals? B, inspect the insertion site for swelling, erythema, or drainage. C, administer a cytotoxic agent to keep the regimen on schedule even if blood return is not present. Or is it D, if unable to aspirate blood, reposition the client and encourage the client to cough. All right, and then this last one, E, contact the healthcare provider about verifying the placement if the status is questionable. All right, so this is the part where you need to understand central venous lines, okay? If you really don't understand, it's very important that you, because if you just see this question, you're only getting the pieces. You want to know the whole thing, okay? So anyways, like I mentioned, let me say the question and the choices one more time. When caring for a client with a central venous line, which of the following nursing actions should be implemented in the plan of care for chemotherapy administration? Select all that apply. Is it A, verify patency of the line by the presence of a blood return at regular intervals? B, inspect the insertion site for swelling, erythema, or drainage? C, administer a cytotoxic agent to keep the regimen on schedule even if blood return is not present? D, if unable to aspirate blood, reposition the client and encourage the client to cough? And E, contact the healthcare provider about verifying placement if the status is questionable. So select all that apply. So go ahead and think about what you believe the answer is, and then I'll go over it. Okay. Okay. So let's go over this one. Oh, I really like this question a lot. I like this question a lot. So, when you begin to when you work in the hospital setting, you're gonna remember this. You really are. You're gonna remember this, and you're gonna understand better. You know, because you're doing it in person, how central venous lines work. So here's what the thing about this question. Let me just fill you in with central venous lines. Um, the priority when you have them is that you need to always verify, that it's working. Okay, you need to verify that's working. And the way that we do this, whenever we are when it comes to central and here, oh yeah, oh I remember this right now. I love central venous lines. I don't know, it sounds very weird, but I really really do, because they're so wonderful. It's like that's anyway. Let me calm down. They're very wonderful. Me in the fact that literally when you need blood, you just all you need to do is just grab a normal saline syringe, and you first, the way that it works is that you first push water in, withdraw. I'm just telling you how to get blood samples, and then you throw that away, and then you draw the blood. So the wonderful thing about central venous lines, it's you like if you need to get blood from the patient, all you have to do is just go to the central venous lines. You can get blood from there, and they should have a blood return. If they don't have a blood return, then that's a red flag, and there's something wrong. So usually, what we'll do when that happens is that we will first attempt to see if we can manually manipulate it. And that's when we'll tell them to, okay, turn. We'll have them turn a little bit. We'll have them cough because they might move something that's like maybe it's stuck, whatever. So we'll have them cough a little bit, and then we'll try it again and see if the blood return begins to flow. And if it still doesn't work, then it's possible that that it's like the tip or something may be occluded. So that's when we give them something called TPA, and the TPA will begin to like break that stuff away, and then we begin to work again. So with this situation, the first one, it says verify patency of the line by the presence of blood return at regular intervals. Yeah, we should always be, in fact, as the nurse, I want to say definitely every time you give a medication through it, ideally every 4 hours, that's when we want to check that it's patent. So the second one says inspect the insertion site for swelling, erythema, or drainage. Yes, absolutely. You always want to be you always want to be checking to see if it's bleeding, especially right here. Like there's been times where you can see the the dressing, and some of it is like coming out on the sides. So you want to check that, see if it's draining, anything like that. So that's a red flag. So we definitely want to do that. So definitely A and B, right? Then it says administer a cytotoxic agent to keep the regimen on schedule, even if blood return is not present. So here's the red flag about that sentence. The second part is so wrong because you always want blood return to be present. We always want blood return to be present. If we don't, then we don't give a cytotoxic agent. Cytotoxic agents will actually, with central venous lines, can cause vesication. It can cause it's not, you're not supposed to give that. So it's not that choice at all. Like that's not one of the choices. In fact, here it says, vessel irritation. When you give a cytotoxic agent, it will cause the vessels to be irritated. So that's versus the other one I was explaining right now with the peripheral line, that's vesication. So vessel irritation is the vessels inside. Vesication is the tissues of the arm. So You might want to, if you don't know what I'm talking about, you may want to Google an image just to see what it looks like for yourself. So anyways, we don't give a cytotoxic agent because it's going to cause the, it's going to irritate the vessel. So no. And then the next one, it says that if unable to aspirate blood, reposition the client and encourage the client to cough. Yes, that's one of them. You aspirate if we can't draw anything back, because that's what it's supposed to do. The central line is supposed to draw blood back. Okay, it's supposed to do that. So if it's not doing that, the first thing we're going to try and do, because we're going to be non-invasive first, is we're going to have them like move a little bit, and as soon as it works, as soon as it does work, have them cough, and then it may open up that and begin to flow again. And then the last one, contact the healthcare provider about verifying placement if the status is questionable. Absolutely, we always want to contact the doctor if we're not sure that it's really in. And technically, when you first put it in, we're supposed to get a chest X-ray, or we're just gonna get some type of confirmation. So yeah, okay. So the choices are A, B, C. I'm sorry, A, B, D, and E. A, B, D, and E. A, B, D, and E. Okay, so hopefully you got that one correct. Okay, so let's see. Okay, so let's do another question. These are some great questions, right? Hopefully it's really challenging you. See, and I know it can be kind of tricky. See, if you don't understand the whole picture of something, then you're not going to choose all the right choices when it comes to select apply questions. So that's why I say that it's very important that you really understand select apply questions before you move on to before you start doing questions, that you really want to understand the content. Okay, so let's do this one. This is about Bell's palsy. It says the nurse knows that care for a patient with Bell's palsy will include which of the following? A, apply an eye patch as needed. B, report any increased lacrimation to the nurse. C, avoid stimulation of the patient's face. D, educate the patient that Bell's palsy is caused by damage to the fifth cranial nerve. So one more time. The nurse knows that care for a patient with Bell's palsy will include which of the following? A, apply an eye patch as needed. B, report any increased lacrimation to the nurse. C, avoid stimulation of the patient's face. D, educate the patient that Bell's palsy is caused by damage to the fifth cranial nerve. Okay, so take your time and then I'll go over the answer. Okay. Okay, so with this choice, you have to know what Bell's palsy is. Okay, and as you know, with Bell's palsy, it is a problem. It is a cerebral Bell's palsy. It's a problem where literally like half of the face is like this. Okay, I see your answer. Okay, so like it's literally like what happens is like half of the face is like distorted, and so we have to be aware. First, you have to be aware of Bell's palsy is in order to pick the right choice. So the question, it says here, do we do A? So which one is right? So meaning that the other choices are not correct. So the nurse knows that care for a patient with Bell's palsy will include which of the following? So A, apply the eye patch as needed. So here's the thing about this patient. When they have Bell's palsy, one of the problems that they have is that their eye can't close. Okay, they cannot close their eyes even when they try to sleep. And that could be a problem because imagine something comes to their eye. Imagine, whatever it may be, that's not good for the eye. We can't force it to close. So it doesn't close completely. Okay, it doesn't close completely. So it's a priority for us to cover the eye. Okay, for us to put the eye patch. as needed. You know, so obviously if it's during the day, we're not going to put it on. But you know, when it's nighttime or any type of something that we're doing where maybe something can get into their eye, you know, we have to cover the eye. So it is A. The reason why it's not B, and B is very, you know, B seems like it is the answer. The reason why it's not B is because it's actually normal for them to have increased lacrimation. That's actually normal. So by you reporting it shows that you don't identify that it's normal. So that's actually normal. We wouldn't do that. And then the next one, we have to actually, we want to do the stimulation that actually helps. And then that's the reason why it's not the third, not C. And then educate the patient that Bell's palsy is caused by the 5th cranial nerve. It's actually the 7th cranial nerve, not the 5th. So that's why it's not that answer. Okay? Okay, so let's do another question. So hopefully that one made sense. Let me see. Let me find a good one. Oh, okay. I think it's a good one right here. Okay, so it says here, the nurse is evaluating. You're going to pick A, but the wording as needed. Oh, I know. Yeah, I know. So whenever you see those type of questions, and it's saying as needed, so that's like PRN, right? And then you got to think it through in your mind and think, okay, we're gonna put the patch as needed, so we're gonna put it on when they need it, you know. So that means they're not gonna always need it. So why would they not always need it? It's sometimes if the eye is always staying open, then why would I? And I like my eyes need to be open right now, so I need to see what I'm doing right now, right? So obviously I'm gonna put the patch on when I do need to put it on. So there are times where you do things that's as needed. Don't allow the word as needed or PRN to throw you off. We do PRN, like that's part of nursing. So whenever you see as needed, that's actually good. That's not actually a red flag. Like that term shouldn't make you say, okay, I don't want to pick that. That's actually a good sign, because that shows that you're responding when there's a change. That you're not just doing it, you know, like it's like just always done that way. Instead you're responding when there's a change, so you're giving it as needed. So that word is a good word actually. Okay, so let's do this one. It's going to be the last one. So this one says, the nurse is evaluating the discharge teaching for a client who has an ileal conduit. Okay, an ileal conduit. Which of the following statements indicates that the client has correctly understood the teaching? Select all that apply. A, if I limit my fluid intake, I will not have to empty. In fact, let me say the question one more time. The nurse is evaluating the discharge teaching for a client who has an ileal conduit. Which of the following statements indicates that the client has correctly understood the teaching? Select all that apply. A, if I limit my fluid intake, I will not have to empty my ostomy pouch as often. B, if I can place an aspirin tablet in my pouch to decrease odor. C, I can usually keep my ostomy pouch on for 3 to 7 days before changing it. D, I must use a skin barrier to protect my skin from urine. And E, I should empty my ostomy pouch of urine when it's full. So one more time. A is if I limit my fluid intake, I will not have to empty my ostomy pouch as often. B, I can place an aspirin tablet in my pouch to decrease odor. C, I can usually keep my ostomy pouch on for 3 to 7 days before changing it. D, I must use a skin barrier to protect my skin from urine. And E, I should empty my ostomy pouch of urine when it's full. So go ahead and think about what you believe the answer may be. Okay. Okay. So let's do this one. So this is another great one. This is another great question. And see, some of these choices, one thing I would encourage you to do, if you really struggle with these type of choices where it's like some type of procedure related, like the central venous line or iliac conduit or colostomy bag, go on YouTube. And this is the part where you can supplement YouTube and just like look up colostomy bag or look up ostomy bag and just watch how it's put on. You know, watch. I mean, you don't have to watch them drain it. I mean, you can actually would be better. You watch those videos, and that will begin to give you a better impression of what we do with as nurses and how it works. You know, like experience is the best teacher, and the second best is video. So definitely watch it. So here's the thing about iliac conduit. The reason why somebody has iliac conduit is because they have impaired urinary elimination. Impaired urinary elimination. So now what we're doing is that we're causing the urine, it's not flowing out where it's supposed to, and so instead of it, like they had to do surgery and they have the conduit, so instead now there's literally a pouch, right, that's on their skin that they live with for the rest of their life, and that's where they collect the urine. Okay, that's where the urine is collected, and they have to just take care of it themselves. So the first one says, if I limit my fluid intake, I will not have to empty my ostomy pouch as often. Here's the thing about this situation. We don't want to tell them to limit their fluid intake actually, because what happens is that then it actually will begin to build like mucus inside the pouch, and then it will become stuck. It won't flow as well. So we want to actually encourage them to drink fluids. And we want to encourage them to drink about 3,000 milliliters of fluid a day, and that will help the flow of everything. We want them to drink fluid. We don't want to tell them to limit the intake, because mucus will build up, and then everything will get clogged up, and it's not good. The second one, I can place aspirin tablet in my pouch to decrease odor. We never ever want to say that. That's so bad. We never want to say, you know, to put the medication like aspirin to decrease odor. No. That's not good. So we don't want to we want to discourage them from doing that. So that's not a choice. The third one says I can usually keep my ostomy pouch on for 3 to 7 days before changing it. That's correct. 3 to 7 days is the correct time frame. So C is one of them. The next one says I must use a skin barrier to protect my skin from urine. So yes, that's one of them too. So and that's what I mean. If you watched a video on ostomies, you will understand the process, the order of how it's placed, and why that's the answer. Because literally the way it works is that you first have to put we spray like the skin barrier first on their skin, and then we put the adhesive, and then we put the pouch. That's the order of how we put it on. So if you didn't know that, you wouldn't know that that's the right answer. So this is what I mean by knowing the content, right? That helps better. So I definitely encourage you to watch a video on that. So that's one of them. That protects the skin from the urine. And then the last one, I should empty my ostomy pouch of urine when it is full. The key word in here is full. You don't want to encourage them to wait till it's full to empty it, because why? If it's full, literally it will begin, the weight of the urine will begin to bear down, and it'll begin to come off the skin, and that's not good. We want to encourage them to empty it when it's 1/3 or 1/2 of the way. So in this situation, the answer is just C and D. C and D. Okay? So hopefully that made sense, and hopefully you took a lot away from the questions. I encourage you to listen to this again from the beginning if you have not, like, listened to this whole thing. And hopefully you'll get some clues and some insights as far as how I'm explaining things. And like I said, when you're hearing stuff for the first time, definitely, like I said, you can go online and like look up a video on like ostomy bags or central venous lines or colostomies, and it will be like, oh, like literally you'll get the whole picture now, and now you'll know why you choose that answer. All right, so hopefully you found this helpful. Okay, and if you have any questions, please free to let me know. All right, so I will see you later, and I hope you have a wonderful rest of the day. Okay, bye-bye.